So if you know Helena Liselingoma, please give her a shout out and let me know today that her name is Heli the Jelly, and say thank you to her for actually putting in a request for this particular video. I haven't been feeling so well, so that's why it's been quite difficult for me to release any past content in the previous days, but I got to feel much better and I thought this would be a very good video to start with. So please make sure that you watch this video till the end, because there's an exercise at the end that will help you understand writing the cause of death. Grab a piece of paper and let's go. Hello and welcome to MK's Medical Review Series. My name is Dr. Moses Kazevu. This is a series on my YouTube channel where we look at medical topics in depth. Today we're going to be looking at writing the cause of death. If you haven't yet subscribed to the channel, please hit the subscribe button, hit the bell notification icon to be receiving notifications of such amazing content every time I post. Grab a piece of paper, grab your pen, and let's go. So remember that most of the individuals actually have a lot of difficulty determining the cause of death, writing out the death certificate, and it's a very big thing because it has certain legal implications. It has certain implications at district level, at provincial level, and even at country level. Worse off even at worldwide level. So which is why we have to get this right from the get-go. So, remember that there are two significant events that happen in a person's life. We have the birth of a person where they're going to receive a birth certificate, and there is death of an individual where they're going to receive a death certificate. So, in between these two important events that happen, the individual has existence, and this starts from the moment where they are born to the moment they die. So in between we have what is known as legal existence. So it's very important that we must record the birth. It's very important that we must record the death of this individual, and recording these births and deaths is actually going to give us this vital basic data about a population, such that anything that we plan to do, any activity we plan to do, such as providing any basic necessities like food, housing, healthcare, education, this can be done effectively because you know how many people were born, how many people are dying, and this can only be successful if we have statistically correct information. And so this is why it's very important to actually register the births. It's very important for us to register the deaths. Now remember that especially with the death registration, which is what I'll focus much on, this information actually is going to be helping many different levels. It may actually even help the doctors indirectly. It may help health workers indirectly, and they may not even know it. Remember that this information is going to be giving us an idea of which medical conditions need to be given serious attention, which medical conditions need to receive research and developmental funding, which medical conditions require certain public health goals to be set, certain healthcare measures or certain measures of the health status to be estimated at a local or district level, at provincial level, at national level, and eventually even at international level, which is why it's very important to write this information correctly. And remember that these mortality values and this mortality data is going to be also important to the doctors and the physicians indirectly, because it does influence the funding that they're going to be receiving for medical and even healthcare research that may actually even alter the clinical practice and directly as a research tool. For example, with a lot of patients, it's noted that a lot of patients are dying from severe malaria. What's the government going to do? The government is going to do, let's pump in more funding to prevent malaria. So they're going to be, of course, positions to train people against malaria. There are going to be newer drugs that they're going to be bought from the country because it's a priority. They've realized that most people are dying from malaria. But now picture this. If you're filling in the death certificates or the certificate of cause of death wrong, and you're giving them wrong information, so it means that the funding would not really be necessarily correct, because say 90% of the people are filling in these certificates wrong and given the wrong cause of death. So it means that 90% of the funding is going to go towards the wrong condition, which is why it's very important. So remember that research topics including identifying disease etiologies, evaluating diagnostic and therapeutic techniques all depend on this information that we get from the death registrations. And it's actually quite common that many people do not know how to fill in these medical death certificates correctly. And even though they have vast knowledge of medical experience, even expertise, some of them actually don't even feel it right. Even some of the senior most doctors don't know how to feel it right. Whilst even some juniors also don't know how to feel it right. Some people don't even know that they're supposed to fill this in. So the different reasons that may be there, they may range from ignorance. Some people have different ways of filling them in, but remember that filling in of this medical death certificate is actually quite universal and similar in all different countries. There's only a slight difference. So now, there are some certificates that you actually get when someone dies, and I want to actually give you a certain distinction, and I want to emphasize this. A death certificate, right? A death certificate does not mean the same thing as a medical certificate of cause of death or a medical death certificate. So when I refer to medical certificate of cause of death, this is the documentation that most of the government employed medical officers, if they're not working in a private institution or if they're not having a private practice, this is what they're going to give you when the patient dies. So you need this medical certificate of cause of death, or it's also referred to as a medical death certificate, to actually get a burial permit. You need this to actually get the death certificate. So there are two different documents. The medical certificate of cause of death and the death certificate are two different documents. This lecture, remember that the death certificate is eventually going to be needed to register the different deaths in the country in the registration book, quote unquote registration book. So when someone actually dies and they're certified that they are dead, you have to determine the cause or causes of death accurately and report it on what we refer to as a medical certificate of cause of death. The medical certificate of cause of death means the same thing as medical death certificate, but these two terms do not mean the same thing as death certificate. So in this lecture, we won't focus much on the death certificate, but we'll be focusing on the medical death certificate or the medical certificate of cause of death. That's what we'll be talking about in this lecture. Then the death certificate is actually a permanent record of the fact of death. So what does this medical death certificate actually try to answer? So it has parts on it. I'll show you a picture very shortly, but it has this basic demographic data. It has the cause of death. It also has other significant conditions that may have contributed to the cause of death. Then remember that this certificate actually should be filled in by a medical practitioner who last attended to the patient, or a practitioner who normally attends to the patient. Never should you fill in this certificate if you do not know the patient. Never should you complete the certificate if you're not so sure about the cause of death. So make sure that you do consult, because you're misleading a lot of people if you do fill it in wrongly. And of course, if the death is unnatural, make sure that you do not fill this. I'll explain what this unnatural death is. So remember that death can either be classified as natural versus unnatural. So if it's a natural death, it's pretty much someone contracting or having a disease process or condition that's going to be recognized in medicine as capable of killing someone. For example, someone with severe liver failure. We know that severe liver failure can actually result in someone dying. But there are some conditions where someone can get and they may not even really die because of that condition. For example, if someone just has a common cold, it's very unlikely that common colds can be actually the common cold directly causing the death of an individual. Though it may happen in some cases, but very unlikely. So we call those deaths where they died, but not because of the condition that they have, but because of something else. We call those as unnatural deaths. So when you have an unnatural death, usually we do not want to fill in a death certificate very quickly. We would want to actually even order an autopsy. We can actually subject this case to the coroner, because this can actually go into what is known as a coroner's inquest. Remember that there are mainly 3 different systems in the world which have to do with these death examinations and all these things in the hospital. But the system that we use in our country and most Commonwealth countries that follow the UK, we use the coroner's system. So remember that all unnatural deaths have medical legal implications and they should be reported to the coroner. So remember that these cases are going to be certified by registered medical practitioners after an autopsy is done. But if there's no foul play that's suspected in the case, then the doctor can actually even request the autopsy from the relatives and perform the autopsy. Then, of course, if it's death due to unnatural causes or there's an element of suspicion of foul play, then we should refer the case to the coroner. So it means all homicides, all cases where patients are BID, brought in dead, you have to actually report them to the coroner. I'll explain who the coroner is. So who can actually fill in this death certificate? Remember that this medical death certificate, not really just death certificate, but medical death certificate all over the world is signed in that very same pattern. And the guidelines for who can actually certify a death certificate, they may vary by jurisdiction, but the certifier is typically going to be a physician, it's going to be a medical examiner, or even a coroner. Then the time in which you can actually fill in the certificate of cause of death actually may vary from country to country. Usually where I do my practice, I don't know if it's an official thing, but usually it's just standard that when someone dies, we actually wait at least 24 hours until we can actually write the certificate of cause of death. And it's only in certain scenarios where they actually seek permission from hospital administration that the certificate can actually be written before 24 hours of the patient actually demising or being certified dead. So remember that the physician's primary responsibility in death registration is actually to complete this medical part of the death certificate accurately. So in Zambia, fortunately, it has been decentralized and the process can actually start at the level of the hospital. Even some other private institutions have been authorized with the ability to actually initiate the preparation of the death certificate. So when someone actually dies, the medical death certificate rather, when someone actually dies in the hospital, then the doctor that was attending to them can actually complete the cause of death section on that medical death certificate and they can actually sign it out. Then in all cases, the attending physician is the one that's going to be responsible for certifying the cause of death, no one else. So it's only the doctor, or it can be the clinical officer, or it could be the medical licentiate, depending on whoever is dealing with the patient that's legally able to fill in these. The other professions in the hospital cannot fill these death certificates. Then in most of the cases, the person that's actually attending, the attending physician to this patient is actually the one that's going to be pronouncing him or her dead, or as well as certifying the cause of death. And of course, only in some instances where this attending physician is not available to certify the cause of death at the time of death, and the law actually provides that the pronouncing physician can be different, then you can actually get someone else who's different who can actually pronounce the death and even fill in the death certificate. But never fill in the death certificate of a patient that you do not truly know. So what are some of these cases that actually where you shouldn't fill in a death certificate immediately? So these cases need to go to the coroner. In our setting here, you need to report them to the police. So if someone has a sudden unexpected death, we report these to the police. If they are accidental deaths such as RTAs, domestic accidents, industrial accidents, they must go to the police. Suicides, homicides, which could be either murder or manslaughter, or deaths from industrial disease, or poisoning deaths even when they are treated in the hospital and the doctor knows the cause of death, or deaths in prison and in police custody, or persons certified dead on arrival at the hospital, so those that die within 24 hours of admission, or deaths in a hotel, in state institutions, or any other public places, or deaths from abortion even when the cause of death is actually even known, or deaths in which the doctor is not capable of stating the precise anatomical cause of death. These must be reported to the coroner. When the relative actually disagrees with the doctor about the circumstances of death, when there is suspicion of negligence by medical staff, or perioperative deaths, including the death or carrying on the operation table, and deaths within 24 hours of surgery. So all these are actually potential cases to actually go for a coroner's inquest, and they must actually be reported to the coroner. So who exactly is the coroner? So a coroner is just pretty much the magistrate who's responsible for that district of his jurisdiction, and they don't actually have applications for this, so they're not selected by applications. So the police officers and even administrative officers in the district actually act as the coroner's officers. These are the people that we actually report to, or depending on these coroner's cases. And remember that That's why we have these police posts at these major hospitals. If you've been to UTH, it's a police post. Where I do my practice at Levy, we unfortunately don't have a police post there. So we actually refer them to the nearest police whenever they come in with a case that needs to be reported to the police. So the coroner's cases actually are the ones that we're going to be referring to as police cases. So we do not fill in the death certificate for these until the police get involved. So here's an example of a medical certificate of cause of death. So here's a counterfoil that you fill in and actually leave attached to this booklet, because there are some audits that go on where they go through these things, and then you're going to be detaching where this line is. So this part here on the right is what you're going to be giving the relative that has come to pick it up. Of course, they must come in to pick it up with some form of identification, because you need to write down their details down here. So there are predominantly 3 sections that are going to be there in this medical certificate of cause of death. So there is this first section here, which is going to be including the demographics of the patient. It's going to be including the time of death. It's going to be including the duration of illness. It's going to be including the fact that this person died because of natural causes. And if they did die because of natural causes, then you come in to fill in this cause of death section, which is divided in 2 parts, part 1 and part 2. I'll talk about it in details very shortly. Or you fill in the causes of death and the approximate intervals between the onset and them dying. Then, of course, you sign when you signed this out certificate. Then you, of course, put your signature there, your qualification and your residency. Then the person whom you're handing the certificate to, this is the third part, the person who you're handing the certificate to, their village, their district, their chief, and their tax receipt folio if it's available. And then, of course, once this has been filled in, you can hand this to this person, and you keep this counter foil, which is going to be kept for reference. So here you just fill in the same details that you're filling in here is the same details that you're going to be filling in over there. So I will give you some examples at the end of this lecture, so please make sure that you stick around. And if you're enjoying this video, drop a comment in the comment section below, hit the like button so that I keep making such more of this content. So what are some of the general guidelines when you're filling in this medical death certificate? So you can think of these as the 10 commandments, even though they're not really 10, but you can think of them as the 10 commandments of filling in a medical death certificate. So number 1 is that you should use the current form that's designated by the country's laws. The one that I beamed to you in the previous slide, that's the form that we use. So make sure that you're using the right form. That's the first thing. Number 2, you must complete each item following specific instructions. For that, I will actually talk to you of how to complete the same certificate, so stick around. Number 3, you must make your entry legible. So you shouldn't write in a way that no one else can read it. You must make it legible. So if you're using a computer printer with high resolution, if you're using a typewriter, use good black ribbon and clean keys. If you're writing it with ink, use at least permanent black ink. That's the third thing. The fourth thing is that we do not use any abbreviations except those that are recommended for specific item instructions. For example, if you are using HIV is an abbreviation, human immunodeficiency virus, so you can use HIV. There are some abbreviations that we can use. There are some abbreviations that we do not use. For example, if you say patient had DIC, disseminated intravascular coagulation, not so many people know DIC, because the people that are doing the death registration are not actually, may not even necessarily be in the healthcare system, so they get DIC and they may not know what it is. Then the fifth thing is that we want to verify the informant's spelling of the name. This is very important. If actually the spelling of the deceased name on this medical certificate of cause of death is different from what is there on their national registration card, their NRC, then that will be rejected and they have to go and get another one filled in. So you should make sure that you have the right spellings, because different spellings for the same sound do exist. For example, Catherine with a C and Catherine with a K, Annette with 2 N's and 1 T, or Annette with 2 N's and 2 T's. So you have those differences in names. So please make sure that you confirm the details of the name as well as the age of the patient. That's the fifth thing. The sixth thing is that you must refer any problems that are not covered in the instructions to the Office of the Registrar General of the Department of Births, Marriage and Deaths. But I think Home Affairs also should be responsible for this death registration, because I remember when my sister passed away, we had to actually go to the Home Affairs office. Then The seventh is, of course, obtaining all signatures. So rubber stamps or any face smiles, signatures are not acceptable. And if the jurisdiction actually provides, we can actually authenticate it electronically. But in our setting here, we haven't yet reached that stage. So most of it is still in the paper system. Then the next thing is that do not make any alterations or any erasures. Do not cancel on the medical certificate of cause of death. If you're canceling, cancel. Properly sign against it, but do not cancel. If you have canceled, just make sure you write a new one. Okay, so it must be clear without any cancellations. Then, of course, you should file the original certificate or report with the registrar. That's the registrar of the General Department of Births, Marriage, and Deaths. Then, of course, reproductions or duplications are not acceptable. So do not make duplications of that. So most countries actually require that the death certificate be completed and filled in within a specific time period, even with the medical certificate of cause of death to be filled in at the exact time. And then the physicians are expected to use their medical trainings, to use their knowledge of medicine and the available history, the investigations that are done, the symptoms, the diagnostic test, the autopsy results. They use everything to make sure that they come up with a cause of death. And this cause of death must be the one that is most likely to have caused this patient to demise. So when we're filling it in, remember that we should have the correct information. So here's just an overview of what we're going to be discussing very shortly. So I've given you two perfect examples of one that's filled in very well and one that's not filled in well. So for example, a patient dies, right? The patient came in, they had a cerebral infarction, they had a stroke, which was due to long-standing atherosclerosis, and eventually they were bedridden, admitted to the hospital, developed decubitus ulcers, went into sepsis, and eventually died. Additionally, or coincidentally, they also had type 2 diabetes that they were also being managed for. So if you're completing this cause of death, this is an example of how this would be well filled in. So remember, there are two parts, part 1 and part 2. Part 1 are the conditions that directly lead to this person's dying. Part 2 are the conditions that are other significant medical conditions that may have contributed but not necessarily directly caused this person's death. So how we fill them in, we start from the one that is the most recent condition to have directly killed this patient to the one that's the most furthest or the most remote, or what we call the underlying cause. The underlying cause is the most important thing on the medical certificate of cause of death. The underlying one is usually the last one on part A, the last thing that you fill, the last line you fill in, that's usually the underlying cause. The immediate cause of death is pretty much the first thing that you fill in, and then the intermediate are these B and C. So this person had septic shock, which was secondary to infected decubitus ulcers, which was secondary to a complication of cerebral infarction, which was secondary to cerebral artery atherosclerosis. This person also had insulin-dependent diabetes mellitus. So if we actually read through this cause of death, you can actually even tell the story of the patient and what they actually had. Then if it's not filled in completely, some information is missing. So suppose you get someone who actually just fills it in like this. So in part 1, they just say pneumonia, which is secondary to malnutrition. And they leave it like that. So here we're not even sure what caused the malnutrition. We're not sure if the pneumonia resulted from the malnutrition and what really caused the malnutrition, because many things can cause malnutrition. So this is very ambiguous, and it's very difficult for us to actually tell what really killed this patient. So some physicians actually can be called from this same office to actually verify information that they have signed. If you haven't signed your death certificates quite well, they'll call you and actually verify the information. Then of course the original cause of death statement may not actually even be wrong. Even this patient, it may not be wrong. This may be what have killed the patient, but because they haven't filled it in with sufficient information to assign certain codes, it makes it very, very, very difficult, because there is something that we call the ICD codes, which every disease that's capable of killing a patient is assigned to. So if we actually write the cause of death like this, it's very difficult to assign these codes when we're doing the death registration. So what are some of the components of the medical death certificate? I think I already went through this when I showed you an image. So we have the demographics of the patient, the name and the age, the date and duration of the illness, the date when they were last alive, the date and time of death, the cause of death section, and of course the certifier section with signatures, which is the one that's at the bottom. So here it is again. So this is the demographics, the date when they were alive, the age of the patient, the last time you attended to them alive, the date of death and the time of death of course, whether the body was identified or not, and whether this is due to natural causes or not. And if it's due to natural causes, you fill these in over there on the cause of death section. And of course, this is where you have your certifier signatures and the person who's actually collecting this medical certificate of the causes of death. So the most important part of this lecture, where we're actually going to go to, is that section of the cause of death section. But before I actually go there, let me just actually talk a little bit about this top part here. That will help you actually fill it in before I actually come to this, because this is the major part here that we will spend most time looking at. So as you can see here, it's pretty much a statement. I hereby certify that I attended. So here, this is where the name of the patient comes in. So if it's John Banda, I attended to John Banda during his, so this is his or her, so during his last illness since, so this is where the time, the date when this person first fell ill. So since maybe the 2nd of May 2023, that such a patient's age was stated to be, so you put the age of the patient there. If they're 19 years, you put 19 years. If they were 2 months, you put 2 months old. Then that I attended him or her, so you simply just complete IMOHER, him or her alive on. So the last time you attended to them alive, you put the day here. So the 5th day of, let me say the 2nd day of June 2023, that he died. So here there is an asterisk here. So this asterisk, if we come here, should the medical attendant not feel justified in taking responsibility of certifying to the fact of death. For example, if you are not really there when this person died and you were only told that this person died, so what you have to write here is, as I am informed. So most of the times we do write as I am informed on this area here. So that he died as I am informed on the day of when he died, the 3rd of June 2023. Then the time here, you put in the time at 21 hours, that I saw and identified the body of the deceased. So here you write deceased, and that to my best of the knowledge and belief, he or her death was in all respect due to natural causes and are here underwritten. So it means that's how you fill in this particular top bit here. So I'll go through it once again. So I hereby certify that I attended to John Zulu or John Banda during his last illness since the 2nd of May 2023, that such a person was stated to be 19 years old, that I attended him alive on the 2nd day of June 2023, that he died as I am informed on the 3rd day of June 2023 at 21 hours, that I saw and identified the body of the deceased, and that to my best of knowledge and belief, his death was in all respect due to natural causes and are here underwritten. So that's how I fill in this top part here. Very simple. So again, here you come in, fill in the same thing. Name of the deceased, you put the name there and the surname. The age of the deceased, you put the age there. The date where you last attended to them alive, you put that here. They died on, you put that here. Even the time here when they died, the body identified deceased. So it means that this part here, from name of deceased to body identified, corresponds to this top part here. Then this cause of death section corresponds to this cause of death section here. As you can see, we have one there, ABC 2. So we have 1 ABC 2 there. So we'll come and talk about this in a lot more detail. Then after that, after I filled this in, which we'll talk about very shortly, you witness my hand. This, maybe if you certify them on the 4th day of June 2023, you put your signature there, your qualification there, and where you stay, your residence. And of course, whom you're giving this to. Usually the nurses fill in the remaining details, who you're giving this to, the name of the person, the village, the district, the chief. This is usually on their NRC. Then of course you fill in you write those details here at the bottom as well. Then of course you come here, you sign again, and you put in your date. Then of course the name and address to the person who you're giving this certificate to. Was this confirmed by post-mortem examination or not? So if it was confirmed, you tick. If it was not confirmed by post-mortem, you tick that or you circle. or you can actually delete the one that's not appropriate. This doesn't really have much instruction of what you must do here. So I've seen many variations of people ticking, some people circling, some people canceling what's not appropriate. So that's how you fill that in. So now let's come to the meat of the discussion and actually look at the cause of death section. So remember that these are diseases, or a disease or injury or injuries that are a combination, or even a combination of these that are going to be initiating a sequence of events that are going to result in cessation of life. So remember that there can be more than one specific thing that can actually cause someone to die, or it can be multiple contributing factors that may cause someone to die. So it means that the cause of death statement that you write on the medical death certificate is actually going to be capturing this sequence of events that is coming from the immediate cause of death, the intermediary cause of deaths, and eventually the underlying cause of deaths. Remember that the underlying cause of death is the one that's the most important thing that's going to be considered, and this must be included in your death certificate, because this is what is going to be used for the death registration and to see how many people are dying because of this condition. But there are some cases where the cause of death may not really be known. So the cause of death may not be as a result of significant anatomic or even lab findings. It may sometimes have been death occurring under certain circumstances. So we call these as death made by exclusion. For example, if someone is drowning, certain electrocutions, asphyxia deaths, especially in infants, those that die from HIE. Then you have hypothermia. You can't really prove these things that someone died of hypothermia, but you may have an idea. For example, you check the temperature of this person just before they died, and you realize that they were severely hypothermic. But when they died, remember, the body begins to be cold. You see that even if you do an autopsy, you may get normal findings. Then, of course, coronary artery spasms. You may not be able to see these things even when you do an autopsy. So this is what we call the death made by exclusion. Then sometimes you may not even have a diagnosis of exclusion. You may even have sometimes that the cause of death cannot be determined. So we call these cases as undetermined. So remember that the cause of death section is designated to actually elicit your opinion as a medical certifier, as a medical doctor, your best opinion as to what killed this patient. But before you actually you fill this and say unknown, you should have made sure that you have exhausted every single thing possible. You have gone through the case files, you have consulted as many people as possible, you have done the autopsy, you have followed up with all the labs that were pending to make sure that for you to now actually certify that this person died because of unknown causes, for you to actually reach that point. So remember that causes of death on the death certificate represent the medical opinion that might vary among different individuals, different physicians. I will even show you later on when we do the exercise. You may get different answers from what the answers that I will show on the screen as compared to the ones that you think about. And of course, the cause of death on the death certificate is going to be representing this medical opinion, like I said. And a properly completed cause of death is actually going to be providing an etiological explanation in an order, type, and even association of events resulting in this person dying. And remember that the initial condition that starts the etiological sequence is actually specific. If it doesn't leave any doubt as to why it developed, then you know that you're on the right track. So for example, if you say sepsis is not specific because a number of conditions can actually result in sepsis. But if you say someone has HIV, human immunodeficiency virus syndrome, you already know that this is specific, this is HIV. When you talk about sepsis, many things can cause sepsis, so you have to be specific. Then, for example, if you're talking about sepsis, maybe you can state even the actual thing that you couched, E. coli sepsis. Then, yeah, actually even much more specific to this. Then, of course, in certifying the cause of death, any disease, abnormality, injury, or poisoning, if believed to have adversely affected the deceased or descendant, you should report these. Then if the use of alcohol and other substances, smoking history, recent pregnancy, injury, or surgery was believed to be a contributing factor to the death, you should also report this. Of course, our medical certificate of cause of death doesn't have the provision to ask about pregnancy and all those things. The one that I was actually looking at from the American side, the one that's offered by the CDC, actually it has that section. So you'll see that on the examples that I show you, they're much more different from the certificate that we use here, but the principle is still the same. And remember that the conditions that are present at the time of death may actually be completely unrelated. So they may be arising independently, and the person may not have died because of these conditions interacting with each other. Sometimes even there may be a causal relation between the conditions, such that one condition can lead to another, and it can lead to a third condition, and so on and so forth. And sometimes even the death may result from a combination of these two or more conditions, or sometimes they may be unrelated. So you have to take note of that. So remember that the cause of death section has two parts. So the first part is pretty much recording the sequence of events that is leading to death. So it's going to be proceeding backwards from the final disease of the condition that was resulting in the death. So what has killed the patient and what has led this patient to develop this condition such that they died. So each part of the condition in part one should actually, so the condition that's above it should be like what caused it. For example, septic shock secondary to infected decubitus ulcers secondary to a stroke. So a specific cause of death should be reported in the last entry. So this one here is the one that's the underlying cause of death. So there should be no ambiguity. Shouldn't mean two different things. So then you have the part two, which is other significant conditions that may have contributed to the death but not directly led to the death. So we can put these in part two. So the cause of death actually should include information that's provided by the pathologist. If an autopsy is done or if a postmortem is done, you must include all this information. So deaths that actually have microscopic examinations that are pending at the time of certification can actually be filled in on the certificate if you have this information available. So if the physician actually has more questions on this, they can actually follow up with the seniors. They can contact the office of the registrar of the General Department of Births, Marriage and Death. Then of course you should note that every cause of death statement is coded for, like I said, and tabulated in the statistical offices according to the latest revision of the ICD, so International Classification of Diseases. So there's an ICD code that's actually given to these conditions. So again, I'll show you this certificate once more. You'll get tired of actually looking at this. By the time we're done, you should actually be well conversant with how to fill this in. So we've already filled in the top part here. We've filled in also this top part here. So what we're looking at now is this second part. So remember that the cause of death is the best physician's best medical opinion, and we should report each disease, abnormality, injury, or poisoning that the physician believes adversely affects the descendant. And the condition, sometimes we can use the word probable if we're not really sure that this is definitively what can have caused this patient's death. For example, if you are suspecting that this person went into liver failure and you didn't get the chance to actually do the tests before they died, so this could be probable hepatic or fulminant hepatic encephalopathy. Then of course, if an organ system failure happens, for example, there are some certain things like congestive heart failure, hepatic failure, renal failure, respiratory failure, which you can't just put on its own like that. It must always be secondary to something. There's something that causes this liver failure. There's something that causes this hepatic failure. So for the same case of the probable fulminant hepatic failure, you can say that this is secondary to hepatitis B infection, chronic hepatitis B infection, or acute hepatitis B infection. Then remember that this must always be secondary to something. For example, if you have renal failure, it's secondary to type 1 diabetes, then that's a complete statement. If you just write congestive heart failure, then that's not going to help us very much because many things can cause heart failure. And of course, when you're indicating that this person died because of a malignancy or neoplasm, then you have to write the primary site, or if the primary site is unknown. 2, you must write whether this is a benign or a malignant tumor. 3, you must write the cell type or the type of cell that, if the type of cell is known, if this is a squamous cell, if this is an adenocarcinoma, you must write. 4, you must write the grade of the neoplasm. Of course, this you can only get on the histology, the grade of the neoplasm. 5, you must write the part or the lobe of the organ that's affected. For example, here's an example. We have a primary well-differentiated squamous cell carcinoma of the lung left upper lobe. This is a very good statement. So for any other person that comes in with fatal injuries, for example, a stab wound to the chest, always report the trauma. For example, there is transection of the subclavian vein, and you must always report also the impairment of the function. For example, there is air embolism that may have contributed to the death. So let's go into part 1. So part 1, like I said, only one cause of death should be filled in one line. And for each cause, you must indicate in the space provided the approximate time interval. So it means the date of onset, not necessarily when you made the diagnosis of the disease, but when they started falling severely sick. to the date where they died. So you must approximate this time. So most people actually do not fill in the time aspect. I'm even one of the culprits for this. They do not actually fill in the approximate time interval. So please make sure that after you watch this video from now on, be in a habit of filling in the approximate time. Then of course, for clarity, do not use any parenthetical statements or any abbreviations like I already said. Then the underlying cause of death should be the one that's entered on the lowest line used in part 1. So usually our lowest line here is C. As you can see, there's a difference now between the other medical cause of death certificates and the one that we use here. The one that we use here usually just has 3 lines. But if you read if you look at other medical certificate of cause of death in other countries, you even see that they have, in part 1, they have A, B, C, D. Here we just have A, B, C. Then they have part 2. We also have part 2. So the concept is still the same. So the underlying cause of death, like I said, is the lowest line in part 1, whether it's on B or it's on C or it's on D. Sometimes it can just be one thing that you fill in on the first line. Make sure that that's specific and that's the underlying thing that has killed this patient. So remember that the underlying cause of death is a disease or injury that's started the sequence of events that has led to someone directly dying. So we're not talking about the mechanism of how this person died. For example, we're not talking about cardiac arrest. No. What caused the cardiac arrest? That is what actually triggered the events of this person dying. So in the case of a violent death, the form of external violence or an accident, remember that the external violence and the accident also has to be included. But at the same time, there are also certain injuries that are going to be taken care of, or injuries that are going to be happening because of this external violence or accident. So even though these 2 events are happening at the same time, they must also be reported. So what are the lines that we have on our part 1? So we have line A. So we have line A, which is our immediate cause of death. So remember that this is the final disease or the injury or the complication that has directly caused this person to trigger into an event that has led them to die. So this must always be put on line number 1. So this can be the only thing that you actually enter as the cause of death in this section. So it's okay. If this is specific, it's okay. And like I said, this doesn't mean the mechanism of death. So we do not want to see things like cardiac arrest. We do not want to see things like respiratory arrest. No. Those are processes that are triggered by something. That thing that is triggering the respiratory arrest, be it a COPD, then it would be the COPD that is causing the death, not really the respiratory arrest. And of course, the mechanism of death, for example, cardiac and respiratory arrest, should not be reported as the immediate cause of death. And because it's not related to the disease process and it's merely just attests to the fact that someone died. And the mechanism of death is actually not going to provide any additional information to the cause of death. If I say someone died because of cardiac arrest, it doesn't give you any significant information about what caused the cardiac arrest. But if I tell you that this person had the acute myocardial infarction that was secondary to coronary artery embolism, then you can have an idea of what has actually killed this patient. So this is our part 1 here. So this is a disease or condition directly leading to death, so which is what we fill in over there. Okay, so here is this special symbol here. Say this does not mean the mode of dying. For example, heart failure, asthenia. It means the disease or injury or complication which caused the death. So it's what we put in here, a single condition per line. And we also put in the approximate interval between the onset and the death. Then line B, which is due to the consequence, what now was causing what is happening in line A. So line B is what caused line A. Line C is what caused line B, and so on and so forth. Line D is what caused line C, like that. So the condition that is below is the one that's causing the condition that's above it. So I don't know if that makes sense. So for as many of the conditions that are involved, you should write the full sequence, 1 condition per line, like I said, with the most recent condition at the top and the underlying cause at the bottom, at the lowest line in part 1. So if more than 4 lines are needed, actually, you can add additional lines. So remember that writing due to between the conditions on the same line is the same as drawing an additional line. So sometimes you can write more than 1 condition on 1 line. So you can just write due to in between, so that you can add like 2 conditions on the line if you do not have enough space. But strictly, it should be 1 condition per line. If you want to add more conditions, you can add an additional line at the bottom. So here's an example of an additional line that was caused. So this person died from asphyxia by vomiting, which was due to cerebral hemorrhage, which was due to hypertension, which was due to primary aldosteronism, which was due to an adrenal adenoma. So the vomiting and the aspiration happened in minutes. The cerebral hemorrhage happened over hours. Hypertension was there for about 3 years. Primary aldosteronism was more than 3 years, and the adrenal adenoma was more than 3 years. So this actually gives us a very good image of how you can actually write this cause of death. So this was actually gotten from page 14 on the CDC manual of cause of death. So you can actually have a look at that. It's a very good book that you can actually read through and have a good read up on these things and have a good understanding. So if the immediate cause of death actually arose as a complication or as a form of error or an accident in surgery or a medical procedure or treatment, it's quite important that you should report what condition was being treated, what medical procedure was performed, what complication or error occurred, and what the result of the complication or the result of the error was. So, like I said, approximate interval between the onset and the death, something that many people actually do not fill in. So remember that the spaces provided on the right of the lines A, B, C, and D, in our case A, B, and C, actually are important for recording the interval between the presumed onset of the condition, remember, not the diagnosis of the condition, and the date of death. So you should be able to actually estimate the time. So this, a good indication is from when they were admitted to the time when they died. That's for the immediate condition. And of course, this should be entered for all the conditions in part 1. Then these intervals usually are established by the physician on the basis of the available information. So our history from the file, make sure that you read through the case and you understand the case very well. So in some cases, you may not know the actual dates. So you may actually write approximately or about, or sometimes it may be unknown. So general terms such as minutes, hours, days, months, years actually is acceptable if necessary. And if the time of onset is entirely unknown, we should state that the interval is unknown. So we shouldn't leave this blank. So for all the certificates that you've actually filled in, if you've left it blank, it's actually quite incomplete. So you shouldn't leave that blank. So this information is useful in coding certain diseases. It also provides a useful check on the accuracy of the reported sequence of conditions. For example, we know that certain conditions cannot develop overnight. Certain conditions usually take some time for them to actually develop. So this is where we can actually tell that, okay, this person actually accurately filled in this death certificate. So what about part 2? So part 2 of the cause of death section actually is these other significant conditions that may not have necessarily contributed to the person dying directly, but have had some impact on this person's life. So other important diseases or other conditions that were present at the time of death that may have contributed to the death, but not led to the underlying cause of death in part 1, we can actually put them in part 2. So sometimes multiple conditions can be put in one line, and the sequence of condition resulting in death are actually quite common. And this is very common in adults. You may get someone dying from one thing, and they may have a bunch of other conditions also being present. So when there are 2 or more possible sequences resulting in death, you must pick the one that has the greatest impact. Okay, I'll give you an example. So this can sometimes be very confusing. For example, if someone has more than one condition that is very significant. So here's an example. Suppose we get a patient, right? And this patient is a diabetic male that has chronic ischemic heart disease, and then eventually they die from pneumonia. So now when the certifying physician now chooses to fill in part 1, there are 3 possible ways in which this person can fill this in. So one possible way is this. So the certifier can report that this person died from pneumonia due to diabetes mellitus in part 1, and then of course the chronic ischemic heart disease is reported in part 2. So that's one possible way in which this can be filled in. The second possible way is that this person would have died due to the pneumonia. So these two both agree that, all 3 scenarios all agree that it's the pneumonia that may have killed this patient. So pneumonia due to the chronic ischemic heart disease, maybe it's a hypostatic type of pneumonia. Due to this chronic ischemic heart disease, that can be entered in part 1, and then the type 2 diabetes can be in part 2 as a significant condition. But remember, diabetes also has some sort of immunosuppression that can predispose someone to developing the pneumonia. Or someone can even decide to add all the conditions in part 1. So where they have died due to pneumonia, which is due to ischemic heart disease, which is due to diabetes. This one makes the most sense because diabetes can predispose an individual to pneumonia. Diabetes can predispose an individual to ischemic heart disease. So you can fill it in as scenario 1, you can fill it in as scenario 2, you can fill in as scenario 3, depending on whatever based you think the patient actually died from, or whatever greatestly impacted the patient. So the way these conditions are coded for when they're doing the death registration is very different, and it's actually important that you should actually have the right sequence that actually fits your patient. So sometimes there is doubt on the cause of death. So in cases where there is doubt, it's necessary to actually have qualifying phrases in either part 1 or part 2 that may reflect uncertainty as the conditions that may have led to death. And of course, in the case where you're not able to establish the cause of death, then you can write unknown. And if you write unknown, you must make sure, and I actually even put this in red, this should be shown only after efforts to make sure that you have tried to determine the cause of death. Even an autopsy has been done, then you can write an unknown cause of death. So this is another example. You get tired of seeing this thing, so you fill in underlying cause of death, actually immediate cause of death, the antecedent or intermediary cause of death, and the underlying cause of death. Then of course part 2 here is other significant condition that may have contributed to the person dying. Then of course the approximate interval and date. So the same conditions that you write here are the same conditions that you're going to be writing here to fill in this medical certificate of cause of death. So here's a brief exercise that I want us to go through. There are simply just 4 questions. So I want you to keep track of how much you get out of 4. Comment in the section below at the end of the exercise of how much you actually get, so that we see if you have actually gotten the concept of filling in this medical certificate of cause of death. So here's our example 1, where I want you guys to determine the cause of death. So shortly after dining on the day prior to admission to the hospital, this 48-year-old male developed a cramping epigastric pain which radiated to his back, followed by nausea and vomiting. The pain was not relieved by positional changes or antacids. The pain persisted, and 24 hours after its onset, the patient sought medical attention. He had a 10-year history of excessive alcohol consumption and a 2-year history of frequent episodes of similar epigastric pain. The patient denied diarrhea, constipation, hematemesis, melena. The patient was admitted to the hospital with a diagnosis of acute exacerbation of chronic pancreatitis. Radiological findings included duodenal ileus and pancreatic calcification. Serum amylase was 4,032 units per liter. The day after admission, the patient seemed to improve. However, that evening he became disoriented, restless, hypotensive. Despite intravenous fluid and vasopressors, the patient remained hypotensive and died. Autopsy revealed many areas of fibrosis in the pancreas, with the remaining areas showing multiple foci of acute inflammation and necrosis. So this is an interesting case 1. So what would you think is the cause of death is? I'll give you some time. You may pause the video before I actually begin to explain. You may pause the video right now. Okay, so let's go through this case once more. So remember that this person is having dinner. Then they develop this crampy pain, epigastric pain that's radiating to the back, followed by nausea and vomiting. So this is pointing us towards pancreatic issues. This person has had a 10-year history of excessive alcohol consumption. So it means already there is some chronic alcoholism that is there. So the chronic alcoholism is what's most likely going to be causing the pancreatitis. Okay, so keep this in mind. So we have the chronic alcoholism and we have this episode of pancreatitis. So the patient denied any diarrhea, constipation, hematemesis, and melena, which can lead to this hemorrhagic pancreatitis. So it's not really hemorrhagic pancreatitis, right? It's not really even the bleeding varices that can be as a result of the alcohol consumption. Okay, none of that. Then they had acute exacerbation of chronic pancreatitis. Then, of course, they did some investigations and they had duodenal ileus and pancreatic calcifications, which may not be so significant in our case this time, because this may not, they can't kill a patient. Okay. Then they became hypotensive. We tried resuscitating. Nothing was done for them. So keep them in mind that they have pancreatitis that was flared up, chronic alcoholism. So here comes the answer. So this person, the immediate thing that caused the death is acute exacerbation of chronic pancreatitis. So this happened in 3 days. Secondary to chronic pancreatitis, which was a diagnosis that they had for 2 years, which was secondary to chronic alcoholism, which is a diagnosis that they had for 10 years. Excuse me. Which is a diagnosis that they had for 10 years. So you see how this order is actually coming in. And I hope you actually have the same answer as what I'm showing you on the screen. We move now to the second scenario. I've already explained this, that do you know ileus and the pancreatic calcification is non-specific and could not have even actually contributed to the death, not even be as a significant other condition. We come to case 2. A 75-year-old male was admitted to the hospital complaining of severe chest pain. He had a 10-year history of atherosclerotic heart disease with EKG findings of myocardial ischemia and several episodes of congestive heart failure controlled by digitalis, preparations, and diuretics. 5 months before this admission, the patient was found to be anemic with a hematocrit of 17 and had to have occult blood and to have occult blood in the stool. A barrier minima revealed a large polypoid mass in the cecum diagnosed as carcinoma by biopsy. Because of the patient's cardiac status, he was not considered to be a surgical candidate. Instead, he was treated with a 5-week course of radiation therapy and periodic packed cell red cell transfusions. He completed the course 3 months before this hospital admission. On this admission, the EKG was diagnostic of an acute wall myocardial infarction. He expired 2 days later. Again, I'll give you some time to pause the video so you can actually determine your cause of death. Do not forget to add the duration. Right, so remember that this is a 75-year-old coming in with severe chest pain. So most likely that this person actually had a myocardial infarction. So the myocardial infarction is what has gotten them. So they expired 2 days. So it was there for about 2 days, right? So it means the immediate thing that killed this person is acute myocardial infarction that was there for 2 days. And this was most likely due to this same 10-year history of atherosclerotic heart disease, atherosclerosis, over a 10-year period. But remember, this person also had some heart failure at a point. But heart failure is not what directly led to this person dying, because the heart failure was controlled. So meaning that the heart failure is another secondary condition, is what we would put in part 2. Then again, they had anemia, which was caused by this cancer. This also didn't kill them because there wasn't any evidence of metastasis from the history that were given. And of course, this was managed and this person received some transfusions for the anemia. So this was another significant finding because it has a potential of killing you, but it may have contributed, but not directly leading to this person's cause of death. So how would you write this out? So this person had acute myocardial infarction, which was for 2 days, secondary to atherosclerotic heart disease for 10 years. Then, of course, the other significant conditions were carcinoma of the cecum, as well as congestive heart failure. Was an autopsy performed? No. So even on that section, on the counterfoil that we look at, if the autopsy wasn't done, we circle no. So remember that acute myocardial infarction listed in part 1, line A, as the immediate cause of death is a direct sequence or a direct consequence of atherosclerotic heart or arteriosclerotic heart disease, the underlying cause of death in part B, part 1 in part B. And then the carcinoma of the cecum as well as the congestive heart failure are listed in part 2 because these things weakened the patient, but they do not really directly lead to, they cannot explain the arteriosclerotic heart disease. We can't explain this by the carcinoma of the cecum. We can't explain this by the congestive heart failure. And these actually are not what are leading to the person going into an acute myocardial infarction. So case 3, which is the second last. So a 34-year-old male was admitted to the hospital with severe shortness of breath. He had a 9-month history of unintentional weight loss, night sweats, and diarrhea. The patient had no history of any medical condition that was that would cause immunodeficiency. An ELISA test and confirmatory Western blot test for HIV were positive. T lymphocyte tests indicated a low T helper suppression ratio. A lung biopsy was positive for pneumocystis carinii pneumonia. This was now renamed as pneumocystis jirovecii pneumonia, so it's no longer carinii, indicating a diagnosis of acquired immunodeficiency syndrome, AIDS. The patient's pneumonia responded to pentamidine therapy and the patient was discharged. The patient had 2 additional admissions for PCP, 17 months after the patient's first discovered to be HIV positive, he again developed PCP but did not respond to therapy. He died 2 weeks later. Okay? So it means that what has killed this... Oh, you may pause the video right now. Sorry, I actually jumped right into explaining. So what has actually killed this patient is they've had this recurrent PCP episodes. So PCP is what has actually led this patient to die. So this PCP, the one that most killed them, remember they had 2 other episodes that were treated, so we don't count as far back as that. So the one that killed them is this one, which was 2 weeks before. But this patient also has HIV that is there. So HIV is a significant thing. Remember that HIV does not mean the same thing as AIDS. They're not synonymous terms, so keep that in mind. So how would you write out this cause of death? So this is most likely due to pneumocystis carinii pneumonia, but this is now pneumocystis jirovecii, which was in 2 weeks. Secondary to acquired immunodeficiency syndrome, because remember, if someone has PCP, obviously that's a stage 4 condition, so they have AIDS. So this is 17 months, then the AIDS is due to HIV infection, which is over 17 months as well. So remember that someone can have HIV and not necessarily have AIDS, and someone cannot have AIDS without having HIV. So usually AIDS is like the end stage of HIV, but for someone to actually reach AIDS, they must get HIV first. So remember, by definition, AIDS is due to HIV infection, like I said. Even though it may seem redundant to specify HIV infection in the casual sequence of death, it's desired that we should do so. So HIV infection and AIDS are not synonymous. Like I said, there is a variable clinical course between the time of HIV infection and the onset of the AIDS. So our last case. So a 75-year-old female had a 15-year history of non-insulin dependent diabetes mellitus, a 13-year history of mild hypertension treated with thiazide diuretics, and uncomplicated myocardial infarction 6 years prior to the present illness. She was found disoriented in her apartment and brought to hospital. On admission, she was noted to be unresponsive, without focal neurological signs, and severely dehydrated with a blood pressure of 90/60. Initial laboratory tests disclosed severe hyperglycemia, hyperosmolarity, azotemia, and mild ketosis without acidosis. A diagnosis of hyperosmolar non-ketotic state, which is also restated to hyperglycemic hyperosmolar state, was made. The patient was vigorously treated with fluids, electrolytes, insulin, broad-spectrum antibiotics, although no source of infection was documented. Within 72 hours, the patient's hyperosmolar hyperglycemic state was resolved. However, she remained anuric with progressive azotemia. Attempts at renal dialysis were unsuccessful, and the patient died on the 8th hospital day in severe renal failure. You may pause the video, think very well on this case before I actually give you the answer. So, this is a 75-year-old female, has a 15-year history of diabetes, non-insulin dependent diabetes mellitus, 13-year history of hypertension, mild hypertension, which was treated with drugs, and they also developed a myocardial infarction. So we can already establish that the mild hypertension and the myocardial infarction may not have caused this person to die. But the diabetes is a significant thing, because the diabetes eventually led to this hyperglycemic hyperosmolar state. Then eventually it's like this person actually went into renal failure, acute kidney injury or acute kidney failure, about 8 days into the hospital admission, and that's what most likely could have killed them. So how would you write this on the death certificate? So this person went into acute renal failure, probably 5 days, which was due to hyperosmolar non-ketotic coma for 8 days, and this is due to diabetes mellitus, non-insulin dependent, for over 15 years. The hypertension and the previous myocardial infarction are other significant conditions that were present in this patient, but not necessarily leading to the death of this patient. So remember that in this case, hypertension and the previous MI would both have contributed factors to the death, but they are not directly leading to what has caused the sequence of death that we are listing in part 1. So I want you to actually comment how many you got from the short exercise that we had on the cause of death, and I really hope you learned a lot from this. If you did, consider subscribing to the channel, hit the bell notification icon so you never miss such amazing content every time I post. Sorry for the very long video, but it was very necessary for you to now understand how to fill in this medical certificate of cause of death. If you enjoyed, please hit the subscribe button, hit the bell notification icon so you never miss such important content every time I post. To Zambia and beyond, my name is Dr. Moses Kazevu. Until next time, bye-bye.